Hi there, donors. Welcome to the world of donor IVF. This can be a little intimidating for you girls, so I'm here to help you with that and walk you through all these phases. Sometimes injections are the scariest part, but this is a very easy thing for you to do. I want you to feel comfortable and relaxed, and basically that's what we're here to do for you today. So the good news for you donors is you are what we like to call most of the time high responders, which means you don't have to use a whole lot of these medications for your ovaries to respond, and so that we have a nice fruitful outcome for you. Basically, to get ready for your first night of injections, I want you to get a few things together, and then we'll talk about how to do the injection. So one of the medications you're going to be using is Menopur. In this box, you're going to have vials of saline, you're going to have vials of the actual Menopur, and you're going to have these things called a Q-cap. So I want you to get all that out on your table now. For most of our donors, you're going to use just one vial of Menopur, which is 75 units. It's going to have this kind of creamy coral cap. And then I also want you to get one vial of the normal saline out. It's going to have kind of a brown label with a gray top. Occasionally, donors, for various reasons, the doctor may actually want you to use 2 vials of Menopur, and we're going to talk about that. So if you're on a 2-vial protocol, go ahead and get 2 vials of the powdered Menopur with the coral cap on it out. You only need 1 Q-cap. And then you'll need a 3 cc syringe. Your pharmacy may have sent to you one that has a needle attached to it, but you want to make sure this says 3 ml or 3 cc. And your needle would be a 27 gauge half-inch needle. If it's attached right now, I want you to go ahead and screw that apart so you have a needle and syringe separately. The second medication I want you to get is your Gonal F, and it's gonna come in a box that looks similar to this, or exactly like this. And we only need you to get, right now, one of those boxes. It would be a 75 international unit box. Occasionally, again, protocols can vary, and you might need 2. We'll talk about that in a minute as well. But for right now, first things first, let's talk about getting your Menopur set up, because we're going to make this as painless as possible, literally, and we're going to try to achieve all of this medication dosing in one subcutaneous injection into your belly. So first things first, I want you to take the 3 ml syringe. I want you to attach it to your Q-cap, and to do that, there's a small piece at the top of this Q-cap. I want you to screw that on top of your 3 ml syringe, or rather to the bottom, and we're going to take this and we're going to draw up 1 ml of air. So I want you to pull the plunger down, and holding the Q-cap towards the sky, I want the top black line of your plunger to fall on 1 ml or 1 cc. Take this air, we're going to pop the gray top off of our normal saline vial, leaving the normal saline on the table just like this. I want you to take your syringe, push it straight down with the Q-cap. Inject all of the air that we just put in, flip everything upside down, and I want you to draw 1 ml of liquid. So at the 1 line, the top of your black plunger is going to come down. If you have air in there, I want you to push it all out so that you have a liquid of 1 ml. Now you pop off your syringe to the first vial, possibly your only vial of Menopur. Take this liquid, push it down onto, snap onto the Menopur powder. Push your liquid into your powder, swirl it around. When it's clear, flip it upside down, and I want you to take every little bit of liquid that's in this vial out. Flick it around, make sure you get every last drop, please. You shouldn't have to measure it, okay? So snap this off. If you're only 1 ml, then you're done at this point. So just pause, I'll tell you where to pick up on this video. If you're 2 syringes or 2 vials of Menopur, we're gonna take this liquid we've just mixed and mix it with our second Menopur. Flip that upside down after you've swirled it around and it's nice and clear. Withdraw all of the liquid that was in that vial as well. It doesn't matter about the measurement, just take every last drop with you. Snap that off. Now we're ready to look at the Gonal F packet. So if you were holding on to that one vial of Menopur. Now you'll pick up with me where you are. In your box, you're gonna have a lot of stuff here. It's possible that the donor coordinator has taken all of this out for you, but if not, and you end up with the entire box, it's okay. Open everything. You're gonna see a syringe here that's pre-filled of bacteriostatic water. You do not need this, so set this aside, or you can even put it into your sharps container. The only thing you need out of this entire packet is your powdered syringe of Gonal-f. You're gonna pop off the cap just like we did for the other medicines. We're gonna take the mixed saline and Menopur and we're going to put it into our powder of Gonal-f by snapping on the Q cap. Push down on all of your liquid, turn it upside down, withdraw all of that liquid once it's mixed and clear, remembering to flick around so that you get all of the liquid out. Again, it doesn't matter about measurement at this point. Snap that off, and now we're ready to prepare our skin. So with the alcohol swab that your kit has given you, I want you to take that, find a nice piece of skin around your belly button, typically within 1 inch of your belly button away from the belly button. You're gonna pinch that skin. We like to call it our muffin top. It's the only time in your life you'll enjoy having one as a woman. And go ahead and clean that skin. You're pinching it and cleaning for 10 seconds, then let it air dry. When you've done that, I want you to take off the Q cap by twisting. I want you to find your needle, screw on that 1/2 inch needle. I want you to push out all of the air that you have seen at the top of your syringe until you have no air bubbles and there is 1 drop, very small drop of liquid that comes out the top of your needle. Now you're ready to inject. Squeeze in that belly, the spot that you just cleaned off. I want you to go in at a 90-degree angle. I want you to inject all of that liquid, no matter the measurement on your syringe. Pull out your syringe, drop it into your sharps container, and you're done.